My name is Dr. David Corwin. I am a hematopathologist here at CellNetix and serve as president of CellNetix. So my personal area of subspecialization is hematopathology, which deals with diseases involving bone marrow, lymph nodes, and blood. Essentially leukemias and lymphomas, either Hodgkin's or non-Hodgkin's lymphomas. Within our group, we also perform on-site flow cytometry, which is a specialized technique that with antigen-antibody reactions and specialized instrumentation looks at individual cells and the character and surface characteristics of those cells to help come to a diagnosis of what type of leukemia are we dealing with, what type of lymphoma, and work from that. We're also expanding our molecular menu of tests. And many of those, in fact, also relate to hematologic diseases. And more becoming prognostically significant and even therapeutically significant, where we document which antigens are present on the cells and how that relates to the expected treatment and survival of those specific diseases. We work very closely with our clinician colleagues in hematopathology. That's usually the hematology oncologist or the radiation therapist. Tremendous amounts of communication back and forth. We usually know and hear from our clinician colleagues when they have a problematic case, when they're going to be doing a bone marrow biopsy or a lymph node biopsy, what their clinical questions are. And the flip of that is that we also communicate very closely with them based on what we're seeing in either peripheral blood smears or lymph node biopsies or bone marrow biopsies. It's a true collaborative relationship between ourselves and the hematology oncology clinicians. We also work very closely with the cytogenetic professionals who evaluate chromosome analysis. That's very commonly a critical element of these sorts of diseases. We have very good working relationships. A day doesn't go by that I don't have 4 or 5 conversations with the cytogeneticist about ongoing cases, and certainly that many with the hematologist. We pride ourselves on providing very fast service for management of those patients. We work with both the hematologists and the cytogenetics professionals, and generally expect that we can turn out at least preliminary diagnoses within 24 hours of the time the patient arrives in the hospitals, and that becomes very critical. Many of these are diseases that we're talking about, leukemias, can progress very, very rapidly, and our goal is to not just move the patient through the system, but more importantly to advance their care rapidly. Even though pathology has limited patient contact directly, I don't think we ever forget that the biopsies that we're reading belong to individuals and real people. I think it's a personalized medicine approach that we take. We pride ourselves on accurate diagnoses and timely diagnosis and service.